All right. Hello, everyone. Thank you for joining us tonight. My name is Savannah Luft. I work at Northwest Missouri AHEC along here with Shelby Wigington, who's also part of the AHEC office. We are going to be here tonight to talk with you guys about health careers, specifically careers in medicine. So tonight we have 4 medical students with us from different medical schools in Missouri who are going to talk to you about applying for medical school, what being a med student is like, and then any other questions you have. So the first question I have for you guys is, can you guys tell me a bit about yourself? Just introduce us to who you are.
I can go first. My name's Rebecca. Most people call me Becky. So if you guys have any questions, I'll answer to both. I went to Savannah High School and I was pretty active in AHEC and also volunteering at Mosaic. That's kind of how I got interested in the medical field. And then I ended up going to Mizzou for undergrad, majored in nutritional sciences, which I really loved. And then after my sophomore year, applied for the Bryan Scholars Program and was pre-accepted into Mizzou's medical school. So that's kind of the gist of it.
Okay. And then, so hobbies and just maybe some of your interests outside of just being a medical student, because you do a lot more than just go to school for medicine.
Yeah, I teach a class at the rec, which I started doing in undergrad. So I teach a group fitness cycling class, which I've been continuing to do. So I've done that for the last 2 years. And this will probably be my last year of teaching that before I head into my clinical years. I'm the youngest of 5 kids. Savannah is very good friends with my sister. And so we kind of live all over the place. Big military family. 3 of my siblings are in the Marine Corps. My dad was in the Navy and the Marine Corps, so we traveled around a lot when I was younger, but kind of consider Northwest Missouri home since I spent most of my time growing up there.
All right, awesome. Who do we have next? Okay, Nick, can you tell us a little bit about yourself next and about just kind of your background, where you went to school, all of that?
Yeah, sure. So I'm from St. Joe. I went to Central and then I went to Missouri Western. While I was at Missouri Western, I majored in biology with a concentration in health sciences. I was in a fraternity when I was in college, and I was a part of the pre-professional club while I was there as well. And while I was at Missouri Western, I did the partners program with Kansas City University. So I applied in my sophomore year, and then I got early acceptance. And so I didn't do the last year of undergrad, and I didn't have to take an MCAT either. And then I went to Kansas City University, and I'm a 3rd year there. So I did my first 2 years at the Joplin campus, and now I'm at Mosaic doing rotations, and I'll be at Mosaic for the next 2 years.
All right. And then Caleb, I think you're next.
Hello, so my name is Caleb. I'm originally from Maryville. It's like 45 minutes north of St. Joe. I went to Maryville High School. Super involved in AHEC as well. I thought it was a super awesome program. So I applied to other places in high school at different colleges because I wasn't sure if I wanted to do like a normal undergrad thing or go to the UMKC 6-year program. And then I ended up choosing the 6-year program at UMKC. So basically, you do your undergrad degree in like 2 years and then the normal 4 years of med school. So right now I'm a 4th year in that, which is like a normal MS2 or a normal 2nd year of med school. And that's where I'm right now. I just took step 1 like 2 weeks ago. So I'm finally done with that. Don't have to deal with that anymore. And some of my hobbies, I'm part of the UMKC cross country and track team. So that's something I've been doing. I also love animals. Like I foster kittens at the KC Pet Project all the time, and it's kind of sad letting them go, but you have them for like 2 weeks, and then you have someone come adopt them. So I do that every once in a while. And then I also like fixing up Volkswagens. As you can see behind me, there's a Volkswagen bus right there that I've been staying in lately. So yeah, that's a bit about me.
All right, and Taylor, finishing us out.
Yes, so my name is Taylor Vogel. I'm from a very small town in Southwest Iowa of about like 1,200 people. And I went to the University of Iowa for undergrad. I majored in human physiology and Spanish. I got a master's at Iowa State in biomedical sciences. And then I worked as a medical scribe in Des Moines for 2 years before I started medical school. And currently, I guess I went to AT Still University for medical school. I'm currently a third year. I'm also in St. Joe completing my rotations with Nick, and Caleb's here for a little while. Yeah, so I'm just finishing third year. My hobbies are my dog. I have a Old English Bulldog named Roxanne, and she's like a tank. And I'm also the youngest, well, my oldest of 5 kids, and we arranged 20 years. So I have a 15-year-old sister that I go home and visit a lot. I'm also engaged. So if I'm not studying, I'm trying to plan a wedding at the same time.
All of the exciting stuff that's definitely easy to do while in med school, right?
Yep.
All right. So if you guys are just getting on the meeting right now, we just introduced the 4 med students that we have with us tonight. We have Rebecka Ernst, who is a second-year medical student from MU. We have Nicklaus Hanlan, who is a third-year medical student from KCU. We have Caleb Fierbacher, who is in his 4th year of the 6-year program at UMKC, and Taylor Vogel, who is a third-year medical student at AT Still KCOM, so the medical school up in Kirksville. All right, so now that we kind of know a little bit more about you guys, can you tell us why you chose to pursue medicine over anything else?
Yeah, I can go first again. So I think I was introduced to medicine really early on, mostly because of AHEC. I think I started volunteering at Mosaic in the end of 8th grade, right before I started high school, and just continued to do that. It was just kind of always kind of pulled in towards medicine, but didn't really know exactly what I wanted to do or why I wanted to do it. I just continued to shadow a lot and started to figure out what I didn't want to do, and continued to shadow physicians for the most part. From there, I went on to undergrad and realized that I really enjoyed nutritional science and felt like I had a really personal just connection with nutrition and how we talk about health with people, and really learned a lot about primary care. And at that point, I was kind of torn between, should I apply for Mizzou's 5-year master's in dietetics program and become a registered dietitian, or should I pursue medicine, which is kind of what I've always thought that I would do. And that was kind of a struggle for me. And then until I realized a lot of what my goals were. And one of the big things was realizing how little of nutrition education positions get during medical school, and realizing that I can incorporate that into my practice and make a really big difference. And so that's kind of one of the big reasons why I decided physician over dietitian, and just how much nutrition plays in primary care. And that's kind of what I'm pursuing right now. Specialty wise, thinking family medicine, OB-GYN, internal med, things like that.
Awesome, thanks. And I think that's really kind of interesting, the point that you made, like you can be interested in things that aren't necessarily specific to medicine, like nutrition, but obviously if you're a physician, you're going to have to talk to your patients about nutrition. So there's really a lot of room for you to incorporate a lot of your other interests into your practice. Is that kind of like why you?
Yeah, and I think I would encourage anyone who's thinking about what they want to major in college to pursue, like to think about majoring in something besides biology or biochemistry, unless that's something that you absolutely love. But you get so much of it in medical school that I'm really glad that I spent 4 years learning about something else. And I think it also set me apart during my interview. I think there were like 8 of us that day, and everyone was a biology or a biochem student except for me. And we talked about nutrition for probably half of my interview.
Oh, cool. Huh.
Mhm.
Well, thank you. We'll go with Nick next.
Yeah, I kind of have a similar introduction, so to speak. I did a lot of shadowing. I think I started maybe like sophomore year of high school, and just decided that I liked healthcare more than anything. I kind of went into college thinking that I was going to be a nurse, actually, and I got accepted to the nursing program at Missouri Western, and I was pretty certain that's what I was going to do. But I just kind of had some conversations with different advisors at the college, and they just kind of led me down the path of the differences between what a doctor does and what a nurse does. And I thought overall the characteristics of the field just kind of drew me in, and decided I would stay. So I ended up turning down the acceptance to the nursing program and sticking with medicine to, I think more than anything, just to fill the desire for leadership. I think that was a big part of it for me, as well as the depth of knowledge. So
Yeah. I think it's kind of really important to note with you, Nick, and Rebecca, that medicine necessarily wasn't like the first thing that you thought you were going to do. And I think it's really important to kind of take undergrad as that opportunity to really kind of explore what you want to do. And so from that, we're going to move over to Caleb, who didn't necessarily have the same undergrad experience and abilities to kind of explore that. So Caleb, can you kind of talk on what led you to medicine, kind of what led you to the 6-year program as opposed to like a typical 4-year program?
Yeah, so similar to those two, I did a lot of shadowing in high school and seeing what fields I was interested in. And honestly, like, I didn't really know what other job I would do for the rest of my life, like besides a doctor. Like, I couldn't really give an answer of like, I want to do this specifically, but for some reason, like the field of medicine kind of drew me in. And I don't know, I just love like the nerdy side of it and like figuring stuff out. I know it's kind of like the stereotypical answer, but I just really didn't know like what else to do, and I really liked it. So I thought I'd go for the 6-year program and see if it was a good fit. And I definitely think it was. So.
And how did you start like your research with the 6-year program? Like how did you get the ball rolling with that?
I heard about it like my freshman year of high school, but I didn't really know what was going on then. And then like my junior year is kind of when you had to get your stuff ready to apply and stuff. And I've just tried to talk to people who are in the program. I know a lot of people like, well, discourage it because they kind of don't know what it all entails. And I tried to talk to people that were actually in it and like see what it was like. And kind of the biggest benefit that I saw was there's no MCAT, and it also saves you 2 years and however much money 2 years of college is, which is also a big factor. So that's kind of what drew me into the 6-year program, as opposed to where I would have gone to normal undergrad, been 4 years, had to work really, really hard for 4 years in undergrad, trying to be apply to med school. But in this way, you apply your senior year of high school. If you get in your first 2 years where you do undergrad at UMKC, there's no working there. You don't have to work super hard to make an application to med school. You're already in, so you just do your undergrad. So that's kind of what drew me to it, is kind of like how easy it was, I guess. Whenever you got like, it's just you get in and then you're good.
Awesome. Thanks for kind of giving us snippet of what we're going to be talking about later, because we'll talk a little bit about more about MCATs and the application process a little further along. So thanks. And then Taylor, I think you're the last one we got.
Yeah, so I guess that what drew me to medicine is like a personal history of having like health problems as a kid, in and out of doctor's appointments. Always kind of looking up to doctors, I guess, because they were always around. And then in middle school and high school, that was just what I was good at. And so it just seemed reasonable. I don't like English. I'm not good at English. You know, it was just something that I did well, and I didn't have to study really hard to do it. Unlike all of you, I was from a really small town in Iowa, and AHEC didn't exist. There's really not shadowing experiences. And I didn't have, no one in my family was in the medical field or had graduated college yet. So that was something that I had to navigate on my own. So I just went to the biggest college I could go to that had a medical school associated with it. So I went to Iowa, and I did well. I did human physiology and then Spanish, thinking that I'd use it in the future. I guess, yeah, that's just in general, like was good at it, general interest. But like they said, also leadership, being the one that's kind of in charge, the one that's like directly making those decisions that's going to help someone's health and impact their future. And just the general knowledge base, it's really, really rewarding.
So Taylor, did you say that you were pre-med in undergrad too then?
I was pre-med, yes. Okay. But then I thought I'd apply, and then I applied to Iowa, and they recommended that I did the master's program. So my master's program was supposed to, I guess I met with administration at Iowa, and they recommended that I do this master's program that mimicked the first year of medical school. So I did that, and it really did. I felt like it made my first year medical school, my first 2 years, a lot easier because I was exposed to a lot of it. And I feel like I probably wouldn't have like the GPA that I did without having had that experience first. Yeah.
Awesome. Thanks for telling us about that too. So before I move on, a lot of you, and Taylor, not so much you, but a lot of you did a lot of research, like shadowing people and like doing programs like AHEC, or just being involved on your undergraduate campus. What are some of the characteristics that people told you needed to have when applying to medical school? Like, what kind of person did they essentially tell you you kind of needed to be while you were in the thick of applying?
Was that for Taylor or for any of us?
That's for all of you. So if you
Okay.
guys, a quick answer.
I think one of the things that really helped me when applying, and that I kind of think advisors told me without directly telling me, was that everything in my application needed to like show my dedication to medicine, but also be really consistent. So for me, like, I think that my two consistencies were the fact that I was really passionate about rural health, and the other one was that I'm really interested in nutrition and primary care. And so I think a lot of my activities that I did throughout undergrad and even starting in high school, being involved with AHEC, I didn't just stop being involved with AHEC after I graduated high school. I still came back and I volunteered at Mosaic over spring breaks and over the summer. And I always emailed AHEC like every semester and just checked in. They wrote my letters of recommendation for medical school. I went on service trips and did rural focus and health focused service trips. And then a lot of my extracurriculars in undergrad focused on nutrition. So not only was I a nutritional sciences major, but I did child health and like obesity medicine research in undergrad. I got interested in exercise science and started teaching a group fitness class. And so I think just showing that consistency and that like real true interest really can make you stand out as an applicant, and just show how serious you are, because when medical schools invest in you, they really don't see the payout until you graduate. So they want to make sure that they're going to accept a student who's going to make it through all 4 years, and be able to finish that degree, because it's not like an undergraduate program where if you drop out, somebody can fill that spot. If you drop out during your 2nd or 3rd year for whatever reason, nobody can fill that. Nobody can make up those 2 years and join your class. So essentially, we're just losing that person in the workforce as a physician. And so I think you can start a lot of finding those interests and that consistency now, even in high school, and continuing that into undergrad.
Awesome, thank you. Does anyone else have anything to add to that?
I think the biggest thing that I saw that's good that the medical schools kind of want to see is that you kind of want to stay in that area, or at least you're interested in the area that you're going to be going to med school at. So like if you go to UNKC or Mizzou or somewhere, they want to see that you're interested in staying in the Midwest, staying in Missouri, going somewhere rural. I think that's super helpful, because they don't want, the whole purpose of like public schools is to keep people in the state, and they don't want a bunch of people coming and then just going to California. I mean, you can do that if you want, but what the school wants to see and what they are trying to get people to do is train people in that area. So expressing interest and showing how you're interested in that area is really important.
I think that's a really good point. Like one of the biggest points that you can make, and even like, I think when I was in high school, I always had the interest and the thought that I might want to stay in Missouri. But I think when you're at this age, like you also think, I have so many places I'd like to live and like to explore. So like, don't let that part scare you either. Just knowing that you have, making sure that it's shown to an admissions committee that you have that interest of, maybe I would stay. I have an interest in coming back to Northwest Missouri or staying in the state of Missouri or the Midwest. But also knowing that it, just because you say that, that's not like the end all be all, because I think that kind of frightened me a lot too when thinking about applying, and my application being so heavily involved with AHEC and all these things. I was like through the Bryant Scholars Program, like it's for students who are from rural areas, but you're not like signing a piece of paper saying that that's what you're going to do.
Right, thanks. Okay. Anyone else? Okay, so now that we've kind of talked a little bit about like what admissions boards want and all that stuff, can you guys tell me the process that it took for you guys to apply to your programs? So like, well, because I know some of you took the MCAT, some of you didn't, some of you had undergrad, some of you didn't. So let's kind of just go through what the application process is like for your schools or your programs.
So I did a pre-acceptance program called the Bryant Scholars Program at Mizzou, which is a program for students who are from rural communities. So probably a lot of you guys would qualify, and it's based off of whatever high school you graduate from. So like Savannah, Maryville, I think Cameron counts, Chillicothe counts, like all of those schools. So I knew about that based from like my freshman year of high school, and you have to have certain like GPA requirements and things like that. So like you want to make sure that you're up to date with all of that stuff and that you qualify. But you apply the end of your sophomore year. And so you have like a high school resume, a college resume, and then a personal statement of why you want to go into medicine, and then a few short answers, which are very focused on rural health and your interest in rural health. But they're pretty easy, pretty straightforward questions. Then you interview that summer. You have 2 interviews that are 30 minutes long with a faculty member. And then I found out before like the first week of school for my junior year that I was accepted. And then I had to take my MCAT a little bit earlier than most people. And there was like a set MCAT score that we all had to get Or like if you didn't get it, you had to do like other requirements to fulfill that. And then we had 2 summer events that were a week long that we had to complete before starting medical school. And it was essentially just a week long session of like mimicking med school. So we have a patient-based learning curriculum where we go through a patient case. So we would do that for a week over the summer, go through the case, learn how to interview a patient, learn how to do a physical exam. And then we would start medical school that after finishing our undergraduate degree, we couldn't get like below a B+ in most of our classes to fulfill our requirement for Bryant. And then we just started and integrated like everyone else. We have to do a few of our rotations, rural track, which Mosaic counts as one of those sites. And also do a couple of clinical time over the summer after our first year of medical school. And that's all of our requirements for the Bryant Scholars Program.
Right. And then can you remind me what year you said that you applied again?
I applied during my sophomore year. I think it's due like June 1st.
Gotcha. And then when you're talking about your sophomore year, because I get this question a lot, is it like the second year you're in school, or if like you took classes in high school for college?
Right. It would be, if you took classes you go based off of credit. So if you were going to graduate in 2 years, say you were a freshman, technically, like it was your first year of undergrad, you had the credits to be a sophomore and you were going to graduate in 3 years total, you would apply during that first year.
Okay, good to know.
And we had a couple of students like in my Bryant class who only went to med school for 3 years and applied like that, and they were accepted. So I think when I was applying, I made sure that I was going to graduate in those 4 years because I knew I wanted to apply for Bryant. But looking back, I would tell somebody else that if you wanted to finish in 3 years, it's possible to get accepted.
Gotcha. Okay, good, thanks. And then Nick, because I think you apply your sophomore year too, would it be the same thing then as well?
Yeah, we applied December of our sophomore year, or maybe November. Yeah.
Cool. And I feel like that was a slight transition into you talking about the KCU experience.
Yeah, for sure. So we applied like it's the fall semester of our sophomore year. I don't remember the exact month, but ours was it's the Partners Program, I think is the name they still use for it. I think some of the requirements have maybe changed a little bit, but I'm not 100% certain. When I did it, it was based off of like college GPA, college activity list, high school GPA, high school activity list, and then an ACT score was required too. So you turn all that in your sophomore year, and then you find out from the school, like Missouri Western, if you make it to their interview process, and then you interview with them, and then they kind of send the applicants on to the medical school. And so they sent, I think there were 3 of us that applied on to KCU, and then you go and do an interview at the campus that you pick, either Kansas City or Joplin. And then I did an interview with the director, I guess, of the partner program, which was different than the other students interviewing there. I was the only Partners Program student they interviewed that day. And essentially after those 2 interviews, you find out like late sophomore year if you were accepted or not. And then you just complete junior year as you would. And you don't have a degree when you leave college. And then they transfer credits from the first year of medical school back to Missouri Western. And so the first year of college the first year of medical school counts for the last year of college and the first year of medical school. So you still finish with a degree. You just don't have it when you first get there.
Okay. So then you still have like your bachelor's then, correct?
Yeah, I have a bachelor's degree in biology.
Cool. And then did you go to the KC or the Kansas City campus or the Joplin campus?
I interviewed in Joplin, and I went to Joplin for the first 2 years as well.
Okay.
Just
And
fit my
so,
style.
so the Joplin campus is that's the satellite campus, right?
Yes, yeah, it was essentially opened after the Joplin tornado took out the big hospital there. They built a temporary hospital and then the big hospital back, and the temporary hospital became a medical school.
Okay. And so how do the satellite classes work then?
You know, they are kind of pushing for like an equal amount of lecturing on both campuses. So I would say maybe 70% of our classes were on Zoom, or we would like watch a presenter. But if you go to the lecture hall, there's still microphones and you can microphone into them and ask the professor a question. And then like 30% of our lectures were given in Joplin, and sometimes the professors travel too. And then we still have like all our lab classes in person. So anatomy lab, KCU is a DO school, so we did our OMM lab in person. Sometimes those are Zoom too, depending on availability and different things like that. But for the most part, it's pretty much a synchronous deal. I feel like a lot of the time you end up watching lecture recorded anyways. So I think it's not a big deal, so to speak.
Right. Okay, thanks. Because I feel like people hear satellite school and they're like, well, how do I learn?
Oh,
It's on Zoom. So thanks. And I didn't even know that they had I mean, I guess they would have to have something for you to ask questions to the teacher, but the microphone thing is cool. Huh. All right, Caleb, tell us about UMKC, because you're probably the most different out of all of them.
Yeah, so UMKC is something you apply in high school, and you apply your senior year. So the only test you have to take for UMKC, the 6-year program, is the ACT, which everyone in high school takes it. So I forgot the exact dates of when you apply, but I think like it's due by like October or something, November of your senior year, the whole application for like just the normal school and the School of Medicine. You do your interviews in like February, and then you get your result of if you're in or not, like in March or April, I think like March. So yeah, and then for the interviews themselves, it's not like a standard interview where they're like, oh, tell me about yourself, like what do you like to do, why do you like medicine. It's literally like 10 different stations that there's like different people at, like faculty or something at the school, and you have 5 minutes with that person, and they just ask you some question that can be related to medicine or not related to medicine, and you just have 5 minutes to talk to them, and then they like ding a bell and you go to the next station, and you do that like 10 times in a row. Like I don't even remember what kind of stuff they ask, but if you look up like multi something interview, like for med school, like you can find questions that they might ask. But that's kind of what they ask you, like random stuff. Yeah, and then other than that, like the application isn't too complicated. Like it's just references, and it's pretty normal. So yeah, you don't have to do any MCAT. I mean, once you're doing undergrad, you're good. So
All right, thank you. And then Taylor, tell us about ATSU.
So I just applied the standard way through, I think it's called a COMIS, or AMCAS for MD, and I think it's a COMIS for DO. But I took the MCAT. You fill out everything on a COMIS. It's kind of a blur. That was a long time ago, but you have to rate all of your, list all of your experiences, write a personal statement. Your MCAT score is kind of pulled in. You typically need a letter of recommendation for almost every school from like 2 doctors, and then the last is kind of typically like a character reference. In the interview process for Kirksville, was just a half day. You came in, you had a little tour, and you met with 3 different faculty or administration or physicians at the hospital that are associated with the school. And I think it was about 15 minutes. They asked all kinds of questions. They had all of your information in front of you. So, if there's a spot in your application that was kind of weak, whether you had a bad MCAT score or what have you, you have the chance to explain it and kind of, I guess, I'm not sure, but you had a chance to talk to them one-on-one, and it was more lengthy. It was about 15 minutes each, and then that was it. I did want to say that I went to Iowa, and when I met with Carver, the medical school there, I met with administration before I applied, and I had all everything in front of me, and this was some of the things that they had told me, and this was more for the question prior, but in your application, in your experiences section, they want a well-rounded student, obviously, and they said that they wanted students to have experiences in research, in teaching or tutoring, shadowing experience, volunteering outside of the hospital, and there was one other thing. But it was these 5 specific things that they wanted your application to touch on. And that's what they were looking for within your application. So that was what my application had in it, because I was told that 2 years prior to me applying and getting into Kirksville. I cannot for the life of me remember what the last one was, but it was that. And then also what Rebecca and Caleb had touched on also is that they want consistency. So they don't want to see that you volunteered to this one place for an hour or two. They wanted lengthy experience time. So at least 20 plus hours in X, Y, and Z, and showing, consistency, not just volunteering for odds and ends just to get, hours. They wanted to know what your specific interests were in. That kind of was off topic, but I wanted to come back and touch on it because that was how I geared my application.
And I think that's a really good kind of thing to point on. And I think consistency is a really important thing for your medical school application. Obviously, they want to really ensure that you do care about people. So if you just do a 8-hour stint at Second Harvest and that's all the volunteer experience you have, then obviously that doesn't necessarily support that you care about community service and serving others. So thank you. Nick, you mentioned also about leadership and how that was kind of something that led you to medicine. And I know that leadership is a really big thing for physicians. A lot of the time, people who are physicians are leaders in the hospital. They're also leaders in the community. So what are some things that you guys did in your application to show your leadership skills or the leadership things that you've done in your undergrad or high school experiences?
I guess I'll start. In college, in high school, I was involved with student government, and I held a position on the cabinet during my senior year, and I think I was involved starting, I was involved freshman, sophomore, and junior year with other positions too, but the cabinet was kind of the overarching for the whole school, kind of bringing in the teaching that was mentioned. I was a tutor in college for biology classes, and then I was also on the executive board for the fraternity that I was in. And then I also, in medical school, continued the tutoring deal, different subject, but that was something that I enjoyed and I was passionate about, so I continued it, and I'm glad I did. But those are probably the kind of the highlights of leadership on my applications.
I can go next. I think I had 3 big things that I did in undergrad that kind of showed leadership. The first was that I was a summer welcome leader at Mizzou, which is just an orientation leader, but you go through extensive training throughout the university. You learn about every single different part of the about every single degree and department at Mizzou, and essentially become an expert. And then all summer, you introduce people to Mizzou's campus and just how to succeed in college. And then I was also an ambassador for the nutrition program. So I also did a lot of mentoring of nutritional science and pre-med students. And then I was also an RA for 3 years at Mizzou. So for me, a lot of my joy came through mentoring students and just kind of helping them find that same success in undergrad and involvement that I did. And I think I just enjoyed that peer-to-peer kind of leadership and was very consistent in those 3 things. And I got paid for all of them. It was super fun. And I think a lot of like my passion for just like people and education came through with being involved with those.
All right. Caleb and Taylor, do you have anything to add to the leadership question?
Really, the only thing I did in high school, like I started this running club, and it was literally like, it sounds so official, like, oh, you started a club, but literally it's just like me and like a few friends that would join, like do once a week in high school, but it looks really good on your resume. So like something like that, like if you can think of something in high school, like what's something you and your friends like doing, and then start a club for it. And then you're the founder of blank club. So that's something that can look really good on your application. Just being involved in sports or other things like that, or theater or anything like band. Like I think that's really good. Try to find leadership roles in that, and I think that's really good. So
as far as leadership, I had experiences similar to Rebecca in that it was a lot of mentoring and tutoring. I did Big Brothers Big Sisters for like 7 years, from high school into college. I did tutoring as well as just general mentoring. I tutored for the athletic department at Iowa State. And I also worked in a lab for the 5 years that I was at Iowa as just a like research assistant. And my last like 3 years, I was the chief, I think that was technically my title, like the chief medical research assistant or something like that. So I scheduled all of the medicals or the research assistants hours. I was in charge of like the mice breeding and colonization. It was really gross, but I did it, and was able to keep track of all of that. Yeah, and kind of just generally managed like making chemicals and things like that.
All right, thank you. So I think that for all of you guys listening, do what you can to build your resume. Like Taylor said, there's really kind of the highlights that they want to see on your application. Then from there, you can kind of use your creativity, imagination, make your own club and find these opportunities for yourselves. So thank you. I think we have one more question and then we'll open it up to student questions. But my last question for you guys is, what advice do you have for high school students? I'm assuming most of the students watching this webinar tonight are interested in maybe applying to medical school. So you already had a lot of good advice now, but is there any parting advice that you'd want to give to someone who might be in your position in a bit?
I would say relax and enjoy high school. Like literally some of the best things that you can do to get into medical school, if that's what you choose, is being a good person, doing what you like. And I think all of that will just come into your application and everything in general, and being healthier and just doing what you like. So you don't need to stress about it every day, about doing specific stuff, about, oh my gosh, I have to get a 95 on this test. Like I have to get this ACT score. Like really just do something that you're really passionate about, or relax, and try to do shadowing and see if it's a field for you. And if you're really sure it is, then I would consider the UMKC program. Apply. You can always say no, but might as well apply, and then you can make your decision when it comes out. So
I would also, oops, sorry, Nick. I would say this goes, I mean, you're going to be applying for a lot of things in the future, college, medical school, away rotations, and like residency. It's never ending. And my biggest advice is start early. I mean, we all are humans, we all procrastinate, but everything from now on is like a rolling cycle. So the sooner you get your application in, it's going to be better for you and you're going to feel a lot better about it. And it's really just going to help your chances. Yeah, that would be my biggest.
I think the biggest advice, like looking back and knowing what I know now, I had kind of this false illusion, like going into the medical school process, like the more I was involved in, the better. That's not necessarily the case though. Sometimes it's like quality over the quantity. So if you can find some core things like you're passionate about, like has kind of been said already, I think that's, it saves you a lot of like time and heartache from having to try to divide your attention so many different directions. If you focus on what you're passionate about, I think it will bode much better for you, and it will certainly show in interviews and on applications.
I think a lot of you guys are probably already ahead of the game, or obviously finding your passions if you're on this call. I think looking back, the biggest thing that I did, and you guys should do, is just get as involved as you can with AHEC. I really worked the program, did all of the things. I think I don't even know how many hours I had, but I spent a lot of my free time doing things with AHEC, and I think it really paid off. And I really made a lot of relationships with people who helped me along the way. There were so many times in undergrad where I was like, I don't even know what I'm doing. I don't know if I can do this. Am I good enough to even apply? Should I spend the money? Should I do this? And my parents aren't in medicine. So me being able to reach out to AHEC and ask all of these questions, and the amount of people I met who I still text and call for advice, I met through AHEC. So that would include messaging any of us. 3 years down the line, if you have a question, I'm sure any of us would answer it, because that's how I got a lot of my answers, too, was just trying to be involved and reaching out to people and finding mentors. The relationships I've made have really made it worth it and helped me find the support I needed to go to med school.
Thank you. And I think that's very true. At AHEC, we work with a lot of medical students, potential medical students, and I really think kind of putting your foundation in your passion in healthcare is really kind of what it takes, because first off, getting into medical school is super confusing. The application process is pretty intensive too. So it's really good to have resources like the med students that we have here today, or AHEC. If healthcare really is your passion, AHEC is a really good organization to pair with, because we have tons of content for you to go through to better expose yourself to healthcare and to better be prepared for healthcare. So Rebecka, Caleb, Nick, Taylor, thank you so much for being here tonight. I'm going to turn our recording off so we can just wrap up.